Joining us now, Dr. Ivan Melendez, the health authority in Hidalgo County, Texas. Dr. Melendez, thank you, sir, for being with us. You described very well the situation in Hidalgo County, where it is poor. There is a higher than average incidence of obesity and diabetes and things that create underlying conditions that make it tougher for people who suffer from coronavirus. It's also a place where people can't work from home as easily. Family count numbers are higher, so social distancing is harder, and that people without an income are desperate to work. It really is the perfect storm. Why did it get this bad?
Boy, that's a really, really good question, why it got this bad. But first of all, I am reminded that I need to thank you for you being so gracious and not forgetting about us down in the Rio Grande Valley. Our 1.2 million population of folks are still in pretty similar situation as we were from that previous reporting. And so I'm just grateful that you haven't forgotten and you've come back to check in with us to let us know what is currently going on. I think that, as we mentioned previously, we have all the ingredients, if you will, of creating a kind of unique scenario. You speak about 1,000 people dying a day in the United States. With our relatively small population of 1.2 million, we had 50, and the rest of the country had 1,000. And so the scenario continues. I can tell you that I just got in from my rounds. I had 34 patients today. 28 were COVID patients. Of those 28, I estimate about 20 are just waiting to go to heaven. It just seems like we're getting one set of moribund patients, and then they process and they go through the system, and then we get another process, another group of people that have that same dire outcome. So we haven't changed. The storm was extremely impactful to us. Our numbers today are way under accounted because the floods have put out even our information technology systems. And we've had some severe impact because of this 70 miles per hour wind and the flooding and damage to the structures that have occurred. So it has gotten worse. The storm was quite impactful.
I want to ask you, Dr. Melendez, about what happens across the border in Mexico. The storm was actually more impactful there. Do you know what the situation is on the other side? Because what you are describing in some ways is mirrored on the other side of the border.
Absolutely. Absolutely, I do. And you have to remember that our population, our grandparents and our cousins and our colleagues, we're a large community and loving each other on both sides of the river. We don't ask for appropriate papers or documentation, and we treat everyone regardless. My colleagues report, and they've sent me videos that demonstrate that some of their hospitals are a foot underwater. You see that people are pushing gurneys under a foot of water. You see completely disregard for their own personal well-being with an appropriate mask being completely wet. And so sometimes when we get so frustrated, of the problems that we have here, during our storm, we had water coming in through the electrical fixtures, water coming in through the walls as we're trying to intubate people or put central lines in. And we feel so discouraged. And yet you just take a brief pause and you understand that just 4 miles south of here, their situation is enough to make you cry.